Well, good evening, everyone, and happy Wednesday to you all. From our homes and offices to yours, welcome to St. Charles Doc Talks. I'm Lisa Goodman, the Public Information Officer for St. Charles and your host for this evening. Doc Talks is a fun, interactive lecture series that we launched back in September so that we could showcase some of our awesome St. Charles doctors talking about topics that they're both knowledgeable and passionate about. From everything from sleep hygiene and diet and exercise to tonight's topic, pelvic floor dysfunction. We hope that you are able to join us for these talks and learn more about some of these very interesting issues and ask questions. So tonight, I will introduce our topic and our speaker. And as you know, we are broadcasting live on Facebook and YouTube. And so we welcome you to submit your questions to Dr. Hellmann once she has concluded her presentation. And we will try to get through as many of those as we can. So pelvic floor dysfunction. It's not really a hot topic that people want to talk about in, say, a party-like setting, but we really should be talking about it more. And the reason being is as many as 1 in 5 people experience pelvic floor dysfunction, which is the inability to correctly relax and coordinate muscles that support lots of important things like your bladder, your rectum, the uterus, the vagina. And you can experience uncomfortable symptoms as a result of that, including constipation or urine leakage. I know these aren't fun things, but for those of us who have had kids and we sneeze, we know what this is all about. So tonight, to talk about this topic is Dr. Sarah Hellmann, who's an OBGYN who enjoys the diversity of working with women at all stages of life and varying backgrounds. She provides a full spectrum of services ranging from pregnancy management to preventive care to pelvic surgery. She truly enjoys taking time to listen to her patients and educate them about their bodies and their health. Now, Dr. Hellmann joined us at St. Charles Medical Group in Redmond because she values relationships and sense of community, and she loves working in a smaller town. And so we're really happy to have her in Redmond. She has served on medical missions in both India and Africa, allowing her to continue her love of traveling and medicine. And when she's not at work, you'll find her playing outside with her husband and her sons and her Australian shepherd. So with that, I am going to turn the time over to Dr. Hellmann. Dr. Hellmann.
Hi. Happy to be here. Okay, so let's get started. Today we're going to talk a little bit about the pelvic floor and pelvic floor dysfunction, and I'm just going to take you through some slides just to give some general knowledge. Okay, so hold on, technical difficulties. Okay. So pelvic floor dysfunction, what is it? Why does it matter? What are the symptoms? How is it diagnosed? And how is it treated? So what is the pelvic floor? So this is a side view, essentially. You can see the various female pelvic organs, the bladder, the uterus, and the vagina, and the rectum. And there's just like this little sling muscle across the bottom from the side. Here are some other views. The picture to the left is looking from the top down, and the picture on the right is looking from the bottom up. And as you can see, there's essentially this bowl of muscle and connective tissue down inside the bony pelvis, and it surrounds and connects and supports the bladder, the rectum, the vagina, and the uterus. Why is it important? Well, I mean, I think the bowel, bladder, vagina, and uterus are very important. And so their connections really have an impact on our daily life, our quality of life, social situations. And so those all have pretty long-reaching effects on our life in general. So what do I mean by dysfunction? Pelvic floor dysfunction is the inability to correctly relax and coordinate your pelvic floor muscles. As you can see in those pictures, there's a lot of different muscles in there. Okay, there's a lot that surrounds those organs. There's a lot that attach to the bony pelvis. And so a lot's going on there during the various mechanisms that our pelvic organs are involved in, such as having bowel movements, urinating, and all of that. So what causes problems with the pelvic floor? Trauma, like a pelvic injury from a car accident, pregnancy and childbirth, overuse, so chronic bearing down, like if you were to be doing consistent, repetitive, heavy lifting, whether that's working out or a job, or you have a chronic cough, aging, being overweight or obese, and pelvic surgery. What does pelvic floor dysfunction look like? It can present as any of these things in a woman. Now, urinary or fecal incontinence, constipation, incomplete emptying of your bowels, pain with urination, pain with sex, low back pain, just general chronic pelvic pain. There are other causes of all of these as well, but pelvic floor dysfunction can certainly contribute, and I think is not as commonly thought of. So oftentimes when I see women, they come in with pelvic pain and they automatically assume that it's their uterus or their ovaries. And I'll show them a picture and say, hey, well, look at this pelvis. It's full of other stuff too. It's full of bowel and bladder. And then there's this big bowl of muscle and connective tissue. And if you have had a baby, likely it's been impacted. So leaking urine or stool, which is incontinence, this again can be caused by multiple different things, but today we're focusing on pelvic floor dysfunction. So, that inability to relax the muscles you need to relax and tighten the muscles you need to tighten can cause this unbalanced muscular control that can cause the leaking of the urine. So if you're not able to hold it when you want to, they may leak, or with you may be too tight, and so you're not emptying your bladder fully. Constipation, another issue. If you're unable to relax the muscles you need to allow the passage of stool, or perhaps the sphincters that are surrounding the rectum are too tight, then that can cause issues with being able to pass, have proper bowel movements. And we all know that's very uncomfortable. Pain with urination and bowel movements. So again, if you look at that picture, all those organs are surrounded by these muscles. And so if these muscles are irritated because of trauma, whether that's a major trauma or micro trauma, it can be painful for things to pass through those muscles. Pain with sex. This is something that a lot of women hesitate to bring up. They're embarrassed by it, and they shouldn't be, because they're not alone. This is not an uncommon issue. If you think about, especially if you've had children, or if you've had a history of sexual trauma, there are a lot of things that can contribute to pain with sex because of this dysfunction of the pelvic floor. If you think about the muscles in your, let's say your back, if you constantly use them, if you constantly overuse them, or you hold a lot of tension there, you get those knots. I'm sure I'm not the only one that's had that, where if someone presses on it, it hurts like crazy, right? That can also happen in the muscles of your pelvis. A lot of women carry stress and tension, they don't even realize it, in the pelvis. And so if you can get, super tight, uncomfortable muscles in your back or your legs or whatever, this can certainly happen in the pelvis. Chronic pelvic pain. Again, there are a lot of different things that can cause chronic pelvic pain, like, issues with your bowels or endometriosis, but pelvic floor dysfunction is also something that can cause chronic pelvic pain. And it's just something that a lot of women don't know about. So how is it diagnosed? The best way to get a diagnosis is to go to a physician who is comfortable in dealing with pelvic pain, pelvic floor dysfunction, and having a thorough medical history. So if you were to come see me, I would ask you about, all the things I mentioned before. Have you had trauma to the pelvis? Do you have a history of childbirth? Do you have a history of sexual trauma? All those things. I would ask all of that. So you want a really thorough medical history. And then a physical exam. That's often a pelvic exam. So that, for me, I want to get a sense of where is this pain? Is it based in the uterus? Is it based, around the ovary? Or is it really within that, bowl of muscle? Can I feel certain areas that are very tight or very loose? Or can I find trigger points, which is an area that you press and it reproduces that pain you're having, or it might shoot pain to other parts of your body, like down your leg or into your vulva, or even up into your abdomen. Sometimes there are these other tests here that people will use, but that's not very standard. So don't expect that if you go in and ask your physician about pelvic floor dysfunction, that you're automatically going to be getting a defecating proctogram. Okay. So, treatment. What can we do about this? And the good news is a lot. So pelvic floor physical therapy is a mainstay of treatment for pelvic floor dysfunction. And again, I want to emphasize again that this is not just all pelvic pain. This is pelvic pain or other pelvic issues related specifically to pelvic floor dysfunction. And so, I'll offer that to patients, and I'll get a lot of surprise, like, oh, what do you mean physical therapy? But it's actually just an incredible way to treat this dysfunction. And I have seen patients' lives absolutely changed by it. Oftentimes, physical therapists will use biofeedback. And essentially what they're doing is, based on your complaint, they're trying to reteach you how to, let's say you have a lot of issues with constipation or incomplete emptying or incontinence. They're going to reteach you how to listen to your body and perform those activities correctly in a way that doesn't make things worse. Oftentimes too, they'll have you do certain stretches or tightening exercises to restore balance to the pelvis. Some women do get benefit from certain types of medications. There is a strong cognitive behavioral component to this treatment because you have to retrain not just your body, but your brain. And so oftentimes relaxation techniques can be helpful just because, as I mentioned before, a lot of women carry stress in their pelvis. And then for some women who have areas that are extremely tender, in the area that I mentioned, trigger points, we can do injections for those. So that is pelvic floor dysfunction in a nutshell. I know that's a real quick and dirty, broad overview. So I welcome any questions that are more specific, but that's it for my presentation right now.
Great. Well, thank you, Dr. Hellmann. That was a great overview of pelvic floor dysfunction. And we do have a number of questions that have been submitted by some of our viewers. So first, how common is this really? I'm embarrassed to bring this up to my doctor. So can you talk a little bit about, how many people really do experience this kind of problem? Sure.
That's a great question. So the numbers show that women who are younger, like teens to 20s, it's around 10%. When you're up to 40 to 50, maybe 25%. And then women who are postmenopausal, 70s, 80s, around 50%. And I believe that is a very conservative number because it's one of those topics that's hard for women to bring up. Brings up shame or embarrassment. It shouldn't, but it does. And so those are the general numbers, but I think that that's somewhat on the low side.
Are there things I can do to strengthen my pelvic floor outside of going to physical therapy?
That's a good question. It really depends on what your presentation is. So, we hear all about Kegels and how important Kegels are for certain types of urinary incontinence, and it's true. But part of the issue with pelvic floor dysfunction for some women is that there are some muscles that are too tight. So it's not just about strengthening, it's also about potentially relaxing certain muscles, or it's about working out trigger point areas, or it's about completely retraining you how to relax and not store all that stress and anxiety in your pelvis. So, not really. You need, I think that to truly get to the root of the problem and really specifically treat it, that's something that you need to figure out with your doctor.
Great. Next question, how is the pelvic floor connected to pelvic pain?
Great question. So pelvic pain has, as I mentioned before, multiple different causes, okay? And pelvic floor dysfunction is one of them. So there's a lot of different things that can contribute to dysfunction of the pelvic floor. Stress, trauma, as I mentioned before. A lot of women store anxiety and stress in their muscles and their pelvis. Women who have had either large traumas from a pelvic fracture or childbirth, or just micro traumas. All of those things can cause hypertonicity, meaning overly tight muscles. And when you have overly tight muscles, you can also contribute to almost like an oversensitization of the nerves that are in that area. So everything just gets really, really sensitive. And so, based on whatever cause, that is what causes the pain. And it can be referred. I mean, if the body is so complex, particularly the pelvis, partial pelvis, I guess, but everything is connected. So, you may have pelvic floor dysfunction that presents as lower abdominal pain. You may have pelvic floor dysfunction that presents as leg pain or groin pain or vulvar pain or, whatever, because, the nerves that are surrounding the area of sort of inflammation, I guess, are very overly sensitive. And so, you can get referred pain. Sometimes for a patient who has like a trigger point, I'll press on a certain area in their pelvis and they feel it in their low back instead of pressing in the pelvis. So it's just a very interconnected area and it's complex. And so there's no really one good answer for that, I guess. Maybe a long answer.
All right, let's say you have pelvic floor disorder. What could occur if you don't have it treated and taken care of?
A lot of the issues that come up regarding pelvic floor dysfunction are quality of life issues. So urinary incontinence or constipation or pain with intercourse. And those can have some pretty serious secondary effects. Let's take pain with sex, for instance. If you are having a lot of pain with intercourse and it's getting to the point where you don't want to be intimate with your partner, that can have a profound effect on your relationship and cause, stress between the two of you. And sometimes you get into this painful cycle where, you have pain with sex, and then when you go to have sex, you're tense because you're worried about the pain with sex, which just makes the pain worse. And you're in this, cycle. And, or let's say, you have issues with constipation and you're bearing down, you're straining all the time to have bowel movements. That not only will worsen your pelvic floor dysfunction, but, it could increase your issues with prolapse if you have any issues with that. So, it's like anything. If your body's telling you something, listen to it.
Great. Speaking of pelvic organ prolapse, can you explain what that is?
Sure. So pelvic organ prolapse is when the pelvic organs, like your bladder or your uterus, or if you don't have a uterus, just your vagina, start to sort of fall down in the pelvis and may even protrude out of the vagina. It causes a feeling of maybe heaviness or fullness or pressure. Some patients will tell me it feels like they're sitting on an egg. It can cause low back pain. And this is because the attachments within the pelvis to these organs are weakened, and your pelvic floor is weakened in general. I mean, the pelvic floor is muscle and connective tissue, and those things are weakened. And so, because the attachments to these organs are weakened, they fall, essentially.
What can I expect at my first appointment for PFD?
So, the first appointment will be lots of questions. I tell all my patients I'm a gynecologist, so I get to ask all the embarrassing questions. So I'm going to ask you about sex. I'm going to ask you about incontinence, things that for a lot of women they feel very inhibited or embarrassed by. I want to create a safe space where they can get it out, because it's stressful to hold on to that stuff and feel like you're the only one. And I want people to know that they're not. So I'm going to ask all the embarrassing questions. And then I'll ask questions about your history, childbirth, trauma. I'll ask about sexual trauma. And then I'll ask, then after that, the questions will be more directed on what's their complaint. So is your complaint urinary incontinence? Are you leaking urine when you don't want to? Okay, well, let's take a look at that. Is it pain with sex? So after all my questions, I'll do an exam. I do an abdominal exam. So that's on the outside. And then I also do an internal exam. I want to feel the different pelvic organs and see where specifically this pain is originating, right? So I want to, if you have a uterus, I'll check the uterus and the cervix. I'll check where the ovaries are. I'll feel back where the rectum is. I'll feel along the bladder and the urethra. And then I feel all those muscles that are in that bowl that I mentioned. And I'll be feeling for areas that feel imbalanced. So let's say your right side is super, super relaxed, but your left side is tight as a violin string. I'll be feeling for tender points, trigger points. I'm going to try and find the area that reproduces the pain you're having, if that's what you're coming to see me for. And then we'll talk about it and come up with a plan.
Great. So is this a problem that affects men, or is it just women?
Pelvic floor dysfunction does affect men. That's not my specialty, but I do know that it can cause issues with urinary issues as well as erectile dysfunction issues. If that's something that a man is concerned about, then I would definitely seek some advice from your primary care physician, and they can help direct him in the direction he needs to go, whether that's colorectal, urology, whatever.
Great. How long do you have to do physical therapy before you are going to start noticing a difference in controlling incontinence?
So they say that around 10 sessions is where you start to really notice a difference. It takes time. But around 10, I would say, is the average, where you start to notice a change in your quality and if it's really helping with the symptoms. Physical therapy is incredible for stress incontinence. It can be such a wonderful tool, but there are other types of incontinence too that aren't necessarily treated by physical therapy. So it just depends on what's the cause.
Great. Let's see, lots of questions about physical therapy. So when you do physical therapy, isn't it just doing Kegels essentially? I mean, I think that's what a lot of people have heard. Do your Kegels, practice them every day.
Yeah.
Get stronger. So really, what is physical therapy beyond just Kegels, which we could do at home?
Oh, sure. Physical therapy is so much more than that. And I wish we had a physical therapist here to give more detail. We have some truly incredible physical therapists here in Central Oregon. We're so lucky to have them. So, physical therapy, well, of course, first they're going to assess you, and they're going to see where the problem lies. Some physical therapists will really work on the trigger points. Some may work on specific strengthening and relaxation techniques. Some may do biofeedback. I know there's just a whole gamut of tools that they use that they could certainly speak to better than I could. So it's definitely more than just doing your Kegels, especially because, like I mentioned earlier, maybe doing Kegels is the last thing you need to do right now, right? So maybe you are too tight and we need to relax that pelvic floor. Kegels are not always the answer.
Great. And we're getting some great questions, but just a reminder, if you're a little embarrassed to send us a question, feel free to use direct messaging so you can maintain your anonymity. We don't want to make any of you feel uncomfortable if you have some kind of awkward questions to ask. So please feel free and ask Dr. Hellmann. She is happy to answer your questions. So going back to treatment, what is the first step to getting treatment? Do we just call our OBGYN? Do we call our primary care doctor? How do we start the care pathway for the treatment?
Yeah, so, if you're already established with a gynecologist, I think probably starting there is great. If you don't have a gynecologist, starting with your primary care doc. Everyone's level of comfort with pelvic exams is different. And so I think calling with a very specific, hey, I'm having pelvic pain, they'll be able to, if you're not already established with a gynecologist, they'll be able to help direct you to where you need to be.
Great. One of our viewers said, I've had these issues for so long. Do you think you can still help me?
Absolutely. Yes. Yes, yes, yes. I have patients that come in their 70s and 80s. I mean, they've clearly had it for a while. And maybe this is the first time anyone's asked them about it, or this is the first time they've had the courage to bring it up. You're never too old. It's never too long, ever. And, let's say you come in, we determine that you have pelvic floor dysfunction, we get you set up with physical therapy. You are never going to walk away from physical therapy without any benefit. Maybe you won't be cured 100%, but you will walk away with more knowledge about your body, stronger, healthier. There's no side effects. There's no negative side effects to this kind of treatment. So no, never too long, never too late.
So do it. If you have it, keep treatment. That's good.
Do it.
Good to do it. So Dr. Hellmann, you did describe some of the traumas or physical damage that can occur down there from various things, sexual trauma, childbirth, but is it also hereditary? Are some of us more prone than others to experience pelvic floor disorder or not?
Great question. It's possible. There's no genetic testing for this, but there is some data out there to show that it is familial, it's generational. So there could be some sort of genetic component. We don't know what that is for sure. But certainly it does tend to, you see some connection within families.
Great. And just one more question. Does having pelvic floor disorder play into your childbirth experience? So if you've experienced some trauma after your first childbirth and then you have a second child, is there any potential risk for that second pregnancy?
Good question. No. I think the pelvic floor dysfunction, it's not going to stop you from getting pregnant. It's not going to stop you from having a healthy pregnancy. I think the stronger and more in tune you are with your pelvic floor, the better, especially in regards to childbirth if you're having a vaginal delivery. But there are no known major issues surrounding pregnancy. Perhaps you might need a little more coaching when you're in the process of delivery during the pushing part. But there's no data to show that you would have an unhealthy or risky pregnancy because of it.
Okay. And finally, this is my question. So I'm a runner. Does running cause any trauma to the pelvic floor? I've heard funny anecdotes about, if you become a distance runner, your vagina is going to fall out. Is that true, Dr. Hellmann?
Well, it really depends on a number of things. So, the key we have somewhat limited control over our pelvic floor in some ways, okay, when it comes to prolapse. As I mentioned before, with the pelvic floor dysfunction, there, could be a genetic component. Certainly when it comes to prolapse, it does tend to run in families. If your mom had issues with prolapse, you may have issues with prolapse. And any sort of like really heavy bearing down can cause an issue. But if your core is tight, actually, if you maintain good physical fitness and keep your weight within a healthy range, you are doing everything you can to stop that from happening. So obesity, lack of strength, those things contribute to prolapse more than running and keeping yourself fit.
Well, that you actually raise an interesting point. So obesity and carrying that extra weight, that can come to bear on pelvic floor disorder.
Yeah, it can definitely have an impact for sure. Mm-hmm. And then of course, I know I mentioned it before, but aging too. I mean, aging, and we just have no control of that,
Not yet.
Not yet.
Another question from a viewer: does PFD cause a woman to have a hard time having an orgasm?
Yes, absolutely. Absolutely. Anything within the pelvic floor that's dysfunctional can have an impact on sex. It can cause pain with sex. And if, there are other things that can cause issues with orgasm as well. So I don't want to, say, yes, that's the only reason. There are other issues as well, which is why it's so important to go in and get a physical exam and chat with your doc about those issues. But certainly pelvic floor dysfunction could have an impact on that.
Great. Well, those are all the questions I've received from viewers. So viewers, if you're out there and you have a burning question for Dr. Hellmann, now is your chance to submit that. Otherwise, we're going to wrap up. So, I see a question coming in. Keep them coming, guys. Does yoga help?
You know what? Yoga is a wonderful way to strengthen your body and find a meditative place in your mind, which is wonderful. And it may help, but if you really have pelvic floor dysfunction, yoga is a great tool to help with it, but you probably need more than that.
Great. Well, Dr. Hellmann, thank you so much for your time this evening. This has been a whole lot of fun. And just a reminder to our viewers, we are recording this and we do post it later. So if you want to watch it again, you missed something, or you'd like to share it with someone, please feel free to do so. So on behalf of St. Charles and all of our team and Dr. Hellmann, thank you all so much. And we look forward to seeing you again back at Doc Talks. Have a great night.
Bye.